If you're a golfer, there's a good chance you started noticing things you never used to think about. Maybe your shoulder feels stiff on the backswing. Maybe your knee aches after walking 18 holes. You might notice that your hips don't rotate the way they once did, or that your lower back tightens after every round. What begins as a minor annoyance often becomes a recurring problem. Many golfers are told that these changes are simply part of getting older. They hear that arthritis is inevitable, that cartilage wears out, and that surgery may eventually be unavoidable. Although aging certainly affects the body, that explanation is often incomplete. Golf places tremendous demands on the musculoskeletal system. You know this. Every swing generates rotational forces that travel through the feet, knees, hips, spine, shoulders, elbows, and wrists. These stressors accumulate over years and even decades. As the tissue quality declines and inflammation increases, the body can reach a point where it struggles to keep up with the demands being placed upon it. Traditionally, treatment options have focused on managing symptoms. And you might be taking those anti-inflammatory medications like ibuprofen that temporarily relieve the discomfort. The anti-inflammatory medications will eat away at your stomach lining, and new research actually shows that it can cause cardiovascular symptoms and problems. And those cortisone injections over time actually wear down your cartilage a lot faster than if you didn't get them. What about physical therapy? It can help you with strength and mobility. I love it. But how much did it really help you to get back to the game that you love? And then in some situations, I hate to tell you this, but you might need to undergo surgery. It might be appropriate for you. Now, each one of those approaches does have a role, but if you're an active adult, a golfer who just loves the game, you're probably looking for an option that will do more than just simply cover up the pain. You are probably looking for a solution that will support your body's natural ability to repair and recover. And that's why regenerative medicine has generated so much interest among golfers. One of the most exciting developments involves Wharton's jelly-derived regenerative tissue products. Now, Wharton's jelly is a specialized connective tissue that's found in the umbilical cord after a healthy delivery. Researchers have discovered that it contains a rich collection of extracellular matrix proteins, growth factors, cytokines, hyaluronic acid, and extracellular vesicles, sometimes called exosomes, that will help to support the tissue repair and the cell-to-cell communication. These biological components create an environment that may encourage healing and recovery within these injured or degenerative tissues. A useful way to think about regenerative medicine is to compare it to caring for a golf course. When the grass simply begins to struggle, the solution is not simply painting the turf green. The real objective is improving the quality of the soil. Once the environment becomes healthier, the grass has a better opportunity to thrive. Regenerative medicine follows a similar philosophy, and that's why I love it. That's why I dedicate my career to it now. Instead of focusing solely on symptom suppression, the goal is to create a biological environment that supports recovery. This concept is particularly important for the shoulder, which is one of the most commonly injured areas among golfers. The rotator cuff plays a critical role in generating the power and maintaining the stability throughout the swing. When these tendons become damaged, you probably experience pain, weakness, a reduced range of motion. A study that was published in 2024 evaluated the use of Wharton's jelly connective tissue allografts. That's the type of treatments that we give, in which we inject pure Wharton's jelly connective tissue into patients with rotator cuff defects. Researchers observed significant improvement in their pain scores, their functional outcomes, meaning that they're able to move better, and patient satisfaction following the treatment. The authors concluded that the treatment demonstrated a favorable safety profile and meaningful clinical benefits for the patients that were studied. Researchers continue to explore exactly how Wharton's jelly exerts its effects. Studies have identified numerous biologically active molecules that may reduce inflammation, improve cellular signaling, improve tissue remodeling and recovery. So, although investigators are still working to fully understand all these mechanisms, the growing body of literature suggests that Wharton's jelly provides more than simple structural support, and that's something that people are surprised to find out. Orange jelly actually provides a scaffolding that all these biological factors now can use to grow and to support the rotator cuff. So one of the most common questions you may ask is whether regenerative medicine can help you return to the game you love, including your shoulder. The answer depends on several factors. It depends on your age, your overall health, how severe the condition is, and how well you can work with a comprehensive recovery plan. Now, no treatment can obviously guarantee a specific outcome, but published research continues to demonstrate encouraging safety profiles and meaningful improvements in pain and function, especially among appropriately selected patients. That's why I review every patient very carefully, just to make sure that you get the maximum benefit from the Warden's Jelly. In fact, I have actually gotten several Warden's Jelly injections in my shoulder. I've had my nurse practitioners do that for me, and I have improved my range of motion and decreased in my pain. So that's why I'm so confident that the appropriate candidates who really follow the programs can do phenomenally well. Ultimately, the goal is not simply reducing your discomfort. The goal is to live the life you really want to live. Golf is far more than a recreational activity for many people. It represents the competition, the friendship, challenge, purpose, and freedom that you love. And when pain begins taking those experiences away, that quality of life suffers. That's why regenerative medicine continues to attract attention for golfers who want to remain active, independent, and engaged in the game for years to come. Imagine stepping into the first tee without worrying about whether your shoulder will hold up. These possibilities are why regenerative medicine represents such an exciting frontier in orthopedic care. The future may not be simply about managing decline. Instead, it's about supporting your body's ability to recover, adapt, and continue performing at the high level long after many people assume that their best years are behind them. I'm Dr. D with Operation Phoenix. Comment shoulder to learn about how to get your swing back.